It's time for Eyes on You from Lifetime Eye Care with Dr. Jeff Anderson and Dr. Courtney Sivertson. Good morning, Dr. Sivertson.
Good morning.
Today we're talking about hypertension.
Right.
Usually that's something I think about with your heart or your body, but I suppose it affects your eyes, which are part of your body.
Yeah, it definitely does. And that's, the reason I thought we talk about this today is because hypertension is so incredibly prevalent.
Sure.
Some studies I've looked at say that over 60% of people who are over 65 have hypertension or high blood pressure.
High blood pressure, sure.
And so it's not an uncommon question that comes up is, how is this high blood pressure possibly going to affect my eyes?
Sure, and I guess, of course, as the population is getting older faster, that population's chunk of the pie is growing, it's an even bigger problem.
Yeah, more and more people are taking medications for that and have that. And so, towards the end of an eye exam, the eye doctor always looks into your eyes with that really bright light.
Mm-hmm. Right.
And we save that to the end so that you can see during the rest of the exam.
Very good.
One of the things we look at when we do that are the blood vessels inside your eye, in your retina. And it's kind of amazing. The eye is the only place where you can actually look inside of somebody's body like that.
Without cutting something open.
Right, without cutting them open and taking a look. So you take a look at those blood vessels, and there's certain things you can see if a person has high blood pressure. You look at the arteries, and they should be a fairly uniform size or diameter. But if they're kind of thick in some places, and then all of a sudden they get real thin and then kind of thick again.
Really?
That's a sign of some high blood pressure.
Okay.
There's places where the arteries and the veins will cross over each other. So there'll be a vein going and then an artery will go over the top of it. And if there's a lot of pressure in that artery, sometimes it'll kind of push down on the vein, almost like you're stepping on a garden hose.
Sure.
And so you can see that when you look in there. You'll see that it's kind of nicking that vein a little bit. If it's been a high blood pressure for quite a while or it's fairly severe, you'll see little hemorrhages where the blood vessels have actually burst some, and you can see little spots of blood in the retina. So the reason that's significant is because if that's happening in your eye where you can look in there and see it, it's happening in your heart.
Sure.
It's happening in your kidneys.
Yeah.
It's maybe happening in your head. And so having this, what's referred to as hypertensive retinopathy, is a sign or a warning sign that you might have some other type of disease issues going on, like heart disease, more prone for stroke, kidney disease, and some things like that. So it's an interesting part of the exam.
I think that it's diabetes that we've also commented on when you guys have brought up that topic, that sometimes an eye doctor can be the first person who notices that a patient has fill in the blank, diabetes or hypertension, because they haven't really had any other symptoms that have gotten them into their regular primary care doctor. But you can see it in the eye vessels, and then that's your first step towards diagnosing the person with that problem even.
Yeah, and it's not uncommon at all for me to, after I get done looking with that bright light, ask the person, do you have some high blood pressure? Have you gotten a check? Lots of times they'll say, I haven't gotten a check for a long time. Sometimes they'll say, well, was it not too long ago? And they said it was fine. And if the person's older, in their 70s or even 80s, sometimes you'll see some little changes like that just over time.
Sure.
And it doesn't necessarily mean that there's definite high blood pressure, but it's still something that if you see that, you want to get it checked to make sure there's not an issue there.
Well, it's also kind of interesting because high blood pressure specifically, sometimes people get a little agitated or emotional when they go into their doctor's office, and then that is explaining the reason why their blood pressure spikes a little bit. But if you can see that the eye vessels are not looking correct, then you know that there is actually something going on. Yeah,
it's not just for that 30 minutes that you're in the clinic. There's something a little more long-term than that.
Oh, that's interesting. All right. And so then, like you said, that does happen quite frequently, that you are the first people that notice something like that.
Yeah, you'll see that in a high percentage of people, especially people that fall into that 65 to older category, that you'll look in there and you'll see some of those changes. And, most of the time, the blood pressure itself doesn't affect a person's vision. In other words, you're not going to come in and say, boy, I can't see well out of these glasses anymore, and then we find a totally different prescription and it's because of your high blood pressure. But you'll just see those little vessel changes. If it gets if it gets to the point where you have a hemorrhage of an artery, that can affect your vision because it'll make your retina damage your retina then, and you're more prone to things like that with high blood pressure too.
It's an excellent reason why you should go in for an eye exam.
Exactly.
And how do people do that?
They can contact us at Lifetime Eye Care. Our number is 282-7121.
They're located on 37th Street Northwest, right across the street from Super America. That's Lifetime Eye Care. Thanks, Dr. Sivertson.
Thank you.